Next, we're going to hear from Congressman Dennis Kucinich. Thank you.
Good afternoon. Good afternoon. It's wonderful to be here with you. And as I'm listening to this discussion today, it reminds me that you are the ones who have to insist that America reconnect and its goodness. Yesterday in the House of Representatives, Americans were told that we can't have peace. We have to keep a war going for another year or two in order to have peace. I voted against that because I believe that we have to take a new direction, which says if you want peace, you vote for peace, and you have a plan for peace. We're being told, in this state and other places, that you can't have kindergarten care or universal pre-kindergarten care. And yet when you accept that, then you don't get it. Efforts are made to just cut short a movement. Today, at this forum, the sub-message is that you can't break the hold that the insurance companies have. Not a single candidate up here has challenged the underlying problem with our healthcare system, and that is insurance companies are holding our healthcare system hostage and forcing millions of Americans into poverty with unconscionable premiums, co-pays, deductibles. So I ask you, is it consonant with America's greatness that candidates step away from the one solution that could change it all? A not-for-profit healthcare system is not only possible, but H.R. 676, a bill that I've introduced in a number of Congresses, the Conyers-Kucinich bill, actually establishes Medicare for all, a single-payer system, and it's a not-for-profit system. It's time we ended this thought that health care is a privilege, it is a basic right, and it's time we ended the control that insurance companies have not only over health care, but over our political system. Think for a moment if Lincoln had decided, well, you know, there's just too much resistance to this idea of emancipation. Think if the suffragettes had decided, well, you know, we can't take on these men who are determined not to include women in the political process. What if Martin Luther King had said, you know, we can only push so far for civil rights? Or if Cesar Chavez had said, well, you know, no puede. What if we buy into this logic that says that can't have peace? We're being told here today to buy into a view of the world which says that, well, you know, we'll have the insurance companies run the system, we'll have people, you know, we'll work out competition between the insurance companies, and maybe we'll have government subsidize the insurance companies. Where's our call for greatness? What if FDR had said, well, you know, we can't really do the New Deal? I'm talking about a real deal for the American people. A universal, single-payer, not-for-profit, Medicare for all, and it's good to be here with you to talk about it. It's already in legislative form. 62 members of Congress have signed on to the bill. Over 14,000 physicians have signed on to the bill. The people of California voted for a plan just like it. The Senate of New Hampshire endorsed it the other day. The legislature in Kansas put their name on it and endorsed the idea. We can do this. Si se puede. Yes, we can. Break the hold of the insurance companies on our health care system and lift the American people out of poverty. That's what my presidency is going to be about. Thank you. Thank you. Thank you. So let's talk.
Sure.
Let's have a conversation.
Well, Congressman, you are the first advocate we've heard today of a single-payer health care system, essentially Medicare for everybody. However, the last time, my understanding is that it was on the ballot was in Oregon, which is, if not, except for Vermont, probably, the most liberal state in the country on these issues, and it didn't pass. Where do you find the political will for a single-payer system?
I traveled this country in the last election, came to an understanding that health care is the one issue that unites everyone. Where does the support come for a not-for-profit health care system? It comes from all over the country, but it's waiting for a candidate for president who will lead the way, and I've already done that. The Conyers Kucinich bill, H.R. 676, is the vehicle. Now, how can you break the hold that insurance companies have? Because let's face it, in Oregon, they pumped millions of dollars into do everything they could to try to defeat the initiative. This is really simple. You need a president who doesn't have strings attached, someone who is ready to confront these insurance industries, someone who isn't owned by the interests. Look at right now in Wall Street, these hedge funds are coming together, pouring millions. Because simply, I don't have any strings attached. I've been in politics 40 years. I've been a councilman, a clerk of courts, a mayor, a state senator, and a 6-term U.S. congressman. I'm known for having integrity and a willingness to take a stand and for changing the outcome when others say it can't be done. This is the moment that I call upon you in the SEIU and the American people to say, let's join this movement that already exists, call upon the power of our hearts and our intellects. What are the animating forces? How's this? Half of the bankruptcies in America right now are directly connected to people not being able to pay their hospital bills. And of that amount, 75% of the people are working, have jobs. People's whole lives are on the line here. So the question is, will the American people be given a real choice in this election? This isn't American Idol here. I mean, really. I could come up here and, and do a little dance about, well, we're going to take on those insurance companies. Oh, really? Are you going to take away their profits? Are you going to remove the fact that, 31% of the money that's in the system right now, of $2.2 trillion a year, goes for the activities of the for-profit system. If we take that money away from the insurance companies and use it for the American people, well, guess what? We have enough money for vision care, dental care, mental health, prescription drugs, and long-term care. I'm going to call on the American people to stand up for their right. Health care as a right, not as a privilege.
Well, Congressman, we have an email question from James in Patterson, California, who wants to know, why are healthcare costs going up so much, and what can we do to stop these increases? And could I just add a question to that? Because in the framework of a single-payer system, people say the consequence of trying to contain costs in a single-payer system would ultimately be rationing. So could you take us through, first, how a single-payer system would address costs, and also what you say about these sorts of concerns that people raise about it?
Think about this now. The insurance companies, when they look at a single-payer system, a not-for-profit system, they'll say, my God, you're going to end up with rationing. What do we have now? 46 million Americans don't even have coverage. Talk about rationing? They're not even in the line. Okay? Give me my portion. No. Another 50 million people don't have any coverage, are underinsured, and the rest are paying these high premiums, copays, and deductibles. We got to break the hold the insurance companies have. And their public relations operations will say, well, rationing. The fact of the matter is, this plan that I'm talking about covers everyone. How do you reduce costs? Let's look at the costs that are involved in the system right now. Corporate profits, stock options, executive salaries, advertising, marketing, the cost of paperwork. All this takes about 31% out of the healthcare dollar. Now, what does all that have to do with health care? Zero. Zip. Nada. I'm talking about creating a system which, by the way, is similar to that in every other industrialized nation in the world. We take the profit out of medicine. Healthcare is a right, it is not a privilege. So how do we control costs? By having everyone in the same pool, everyone, having everyone covered, and having the benefits be available to everyone, whatever their income, no means testing, and by creating a movement. Now, I want to add something to an earlier question you raised, and that is that, and my good friend Senator Edwards, who he and I campaigned together 4 years ago, he raised this question, which is which is the question in Washington. Well, it's just not feasible to take this plan for not-for-profit health care. Senator Clinton talked about challenging insurance companies, but doesn't really get to the ultimate challenge, and that is who controls health care in America. Senator Obama is still developing his plan. This plan that I'm talking about, I co-authored this plan. I'm one of the ones who wrote the plan. I know the way the system is set up. The area that I represent in Cleveland, people are losing their homes because they can't pay the doctor bills. And so the question is, what it ultimately comes down to is who has the courage and the willingness to take a stand, breadth and depth of the American people, and call forth our greatness to say we're going to change this. We're not going to be trapped by these insurance companies who give us diminishing returns, who insist on higher premiums, co-pays, and deductibles.
Thank you. Congressman, you're kind of an urban kind of guy. And Ashley Osborne, who is a labor and delivery nurse in Elko, which is a rural county in northern Nevada, has a question for you about how you would address concerns in people who are in her situation.
Good morning. As you know, my name's Ashley Osborne, and I'm a labor nurse in Elko, Nevada, which is a rural area up in northeastern Nevada. And commonly I see moms come in to my department with severe pregnancy-induced healthcare issues that could be eliminated or caught early with prenatal care. Unfortunately, they are unable to get that. What are your plans on improving healthcare in the rural area in the U.S.?
Well, first of all, this plan covers everyone, and rural as well as urban areas alike. Rural areas tend to be underserved. I'm looking also at creating an infrastructure program to create millions of jobs, rebuilding America's infrastructure, which would build hospitals in rural areas. And rural people would then have access, because access is the huge question in rural areas. And when you talked about women being able to get the care they need, this system, prenatal care, postnatal care, I have a plan for child care. It doesn't try to stop women from getting the care they need because there's an insurance agent telling a doctor, an OBGYN doctor, who said, well, you just can't do that. You're asking for too much. This system will meet the healthcare needs of the American people. We're being told we just can't have those needs met. We've got to start thinking differently. Does that answer your question? Thank you.
Thanks. And now I would like to turn to a public health student here at UNLV, Megan McCormick, who raises a pertinent point. If there's any place where you're interested in outcomes, it's in healthcare. Megan?
Hello, right here. I'm Megan McCormick. I'm a junior at UNLV here. We're spending an increasing percentage of our gross domestic product on healthcare while we continue to have poorer outcomes than those countries who are allocating a lower percentage of their GDP towards their own healthcare. How does America plan to stay globally competitive with increasing healthcare costs?
That is a key question. In my own congressional district, we have auto plants that have been threatened, and others across the country have been threatened because the high cost of health care is causing Ford and GM to pay billions of dollars of health care costs. Now, Canada, on the other hand, has a much stronger industry because they have a health care plan for their people. This plan that I'm talking about is going to help American business. It's going to strengthen the economy. It's going to make it possible for individuals to be able to hold on to more of their money. It's true that many families right now are spending in excess of $10,000 a year for health care. With this plan, only a fraction of the money that is being spent right now would have to be part of the financing of the system. I mean, do you know that 60% right now of the money that's in health care is spent by the government? The government has 60% of the spending right now. If you eliminate administrative costs, if you bulk purchase of drugs, just the way veterans does, you start to come up with the money that you need to provide coverage for everyone, and that is a major help for small businesses and large businesses alike. This patchwork proposal that you've been given here today by other candidates locks us into insurance companies who then take their pound of flesh, and generally it keeps people from being able to have any control over their own budgets. I want to go back to what most American people are experiencing: economic uncertainty because of the way the healthcare system is set up. People are aware, no matter how much money they have, that if they have an illness in the family, it could wipe them out. Who isn't going to make the choice to take care of a loved one? You do what you have to. But why, I would ask you, should someone have to lose their home in order to ensure the health of a loved one? Why should someone not be able to get the long-term care they need for a loved one, or have to sign on the dotted line to give away everything you've worked for a lifetime in order to get the long-term care you need? See, what I'm talking about is a real transformation. I think the American people are ready for that. But they need someone to be not just the messenger, but someone who knows this issue, is ready to stand up and speak out. Yes, we can improve our economy and save our businesses large and small. And I'm dedicated to do that. And I'm able to do it too. Thank you.
You know, Congressman, earlier, Senator Edwards payer Medicare-like option built into his plan. And it would be, one of the things that people could consider in making their health care choices. And he raised the possibility that if that were out there as an option and people started choosing it and found out that they really liked it, that the country could almost, evolve toward a single payer system. Do you see this as a real scenario given the other interests that are out there? Or do you think that, in fact, it's going to have to sort of come down in one fell swoop if it's ever going to happen?
Well, you just answered the question, and that is that if you have competition between insurance companies, everyone knows what happens. That doesn't drive down costs, it drives up profits. That's the fact. If you say, well, you're going to give people a choice, either be on a private plan or be with the government, what happens is that the private companies start cherry-picking the best, the people in the best health, and then you end up with what's called adverse selection. Those who are the most medically compromised end up on programs that the government's paying for, and then the government program starts to go down. You end up in an insurance death spiral, what is, what's called in the industry. Now think about it. Candidates are up here advocating that government provide subsidies to the insurance industry. What's that about? I mean, didn't we have enough of subsidizing the pharmaceutical companies with that phony Medicare D program that President Bush had? How are we any different as Democrats? Think about that. Do you know what? Universal health care. Oh, everybody's for it. Almost is resonant with that fella in the Music Man who says, there's trouble in River City. Universal health care. You know what? Even the insurance companies are for universal health care, especially the insurance companies, if the government's subsidizing them. What a deal that is for the insurance companies, but what a rotten deal it is for the American people. We've got to have not-for-profit health care. Get the insurance companies out of the picture. Health care is not a privilege. It is a right, and it is a human right. Universal health care, right. I mean, come on. You need a president who didn't fall off a Christmas tree. You need a president who will be involved in straight talk, straight from the shoulder. And you need a president who doesn't have a key in the back, being wound up by special interests to come before the American people and tell them what the interests want. I'm telling you what the American people want, and I'm ready to take that message all across this country, and I'd like your help in doing it. Thank you. I have 4 seconds left. Buzzer shot. You want not-for-profit health care? I'm the candidate who can deliver. Casitas.us. Thank you very much.
Thank you very much, Congressman.
Well, I've been it ever since I was a kid at school. Now they love me in the castle and